Infectious diseases kill thousands of Australians every year, and there is one that is fast, ferocious and frightening, and that's meningococcal disease.
With Dylan, on the night that it happened, to give you some idea of how quick, it was probably the first 4 hours we're at the first hospital, and they sent us home. They couldn't pick up any significant signs, and they asked us to monitor him at home for deterioration or a rash and bring him back. We weren't aware of the seriousness of those signs, and we ended up seeing a little pinprick on the side of his neck. As soon as I picked him out of bed, he had the high-pitched cry, which sounded like he was quite in severe pain. We immediately took him to a GP. The GP recognised him straight away as septic, and by the time we got to the second hospital, which was 10 minutes away, they were ready for him. He was then moved to a much larger hospital, and in that small time he already had a cardiac arrest. They had to try and revive him. This is probably 12 hours after his fever, and 3 hours later he passed away in emergency at the Children's Hospital.
Meningococcal disease is caused by a bacterium that mostly sits quietly at the back of the throat. Indeed, up to 1 in 5 people are carriers, but we just don't know who is a carrier and who isn't. Almost anyone can catch meningococcal disease. It is caught by normal human activities like coughing, cuddling, kissing and sneezing. Meningococcal disease affects hundreds of Australians every year. It can be deadly within hours. In fact, 5 to 10% of cases die, and more than 20% are left with permanent physical disabilities. The key signs and symptoms of meningococcal disease are a high fever, muscle aches and pains, cold hands, and a rash that starts pinprick and then becomes larger and purple. Pressing a glass against it, the colour doesn't go away. Danielle was just so fortunate to survive. She had expert and early treatment, but her form of meningococcal disease was fast and fulminant, progressing to shock and gangrene in all her limbs. Because of intensive care, she did survive, but with severe scarring and at the expense of an arm, many fingers, and the chance to grow to a normal height. You don't know if you're a carrier of meningococcal disease, but we do know that babies, young people and teenagers are especially at risk, but almost anyone can suffer meningococcal disease. Australia was one of the first countries to introduce a vaccine against meningococcal disease, Group C. But for Group B, the most common cause, there are vaccines around the corner, but not yet available. Meningococcal disease is treatable. Meningococcal disease is preventable. How can we better recognise, treat, and prevent this ferocious disease? Build your chain of protection for you and your family. Visit www.chainofprotection.org. Well, the rest is up to you.